So the other thing I would caveat or warn you about is that the pain from arthritis is often the pain from something else. So I can't tell you how many times people come into my office and tell me another doctor told them they were bone on bone and that their only option would be a total knee arthroplasty. Well, first of all, I get weight-bearing x-rays and see a joint space, probably 95 times out of 100 in that case. And then second of all, a lot of times the pain is from something else and not even the bone on bone. And I will tell you this, there is to date, okay, we're in 2022, no study that has ever correlated what is seen on an x-ray with how somebody feels. No study has ever correlated what is found on an MRI with how somebody feels. And I can go on with every type of imaging study. So just, let's say you are bone on bone really. It doesn't mean it has to hurt. I got plenty of patients walking around bone on bone with no pain. And I got a lot of patients that have beautiful joint spaces and a lot of pain. So you got to start thinking through what else could be the problem. And I'm just going to quickly run through some things for you because I'm sure some people out there have knee pain. And then I want you to know that even if you are convinced you need surgery and you want surgery, because some people do, your outcome after surgery will be vastly improved if you do these things I'm going to tell you to do. My goal is for you to avoid surgery, of course. But let's say you still have to have it, or your surgeon convinces you have to have it, or you feel really strongly about it. You can still do this and have a much better outcome. So hopefully I'm helping everybody out there. Okay. Nerve pain, probably one of the biggest sources of pain. Well, actually the only source, if you think about it. The only reason your brain ever feels pain is because it gets an electrical signal through an electrical wire from some sensory organ in the periphery. And so look at the knee, look how many nerves are involved. Anything can happen to any of those nerves, cause pain, and it could be misconstrued as arthritic pain. I've been doing a lot of peripheral nerve stimulators for people to address chronic pain, which is a much less invasive procedure, much safer and quicker return to activity for certain chronic pain problems with joints. And these are the nerves we target. So think about nerve pain first when you've got a painful joint. Next. And I'm just giving you the differential here. I know this talks mostly about arthritis. It could be from anything around it. Remember I told you it's a whole organ disease? You could have a tear in the capsule. You could have an inflamed synovial lining. It could be one of the tendons coming down to the joint. It could be the subchondral bone. That's the bone that sits right under the cartilage that gives it sort of a firm place to sit on and allows motion. And of course, it could be from any inflammatory mediator inside of the joint. It doesn't have to be worn out cartilage that's bone on bone that hurts. Remember, cartilage has no nerve cells, by the way, so cartilage never hurts. It's always something else. Next. So let's talk about the inside of the knee, the medial knee. You could have a contracture of the adductor tendon. Those are the tendons that let you cross your leg, and like if you ride horses, let you hold the horse. So those can get contracted and cause severe pain on the inside of the knee, as can hamstring contractures. Okay, you could have. Okay, same things happening in tendons. Look at the box on the bottom there where it says treatments. I pulled this from a prominent journal in the orthopedic world on how to treat tendon problems, tendinitis, tendinosis. Note that nothing there is about diet, nothing about supplements, nothing about lifestyle, nothing about sleep, nothing about stress management. And I think that's the problem. That's where medicine is stuck. Orthopedics is stuck there. PT, drugs, inserts, injections, which of course means steroids, right? What could be worse? Shockwave therapy or surgery. Those are the options that you're normally offered, and I just want to offer you more than that. And that's why I'm giving you this talk.
A few people saying, exactly, doctors just want to prescribe meds that have so many side effects. It's awful.
Okay, we're getting some people in the crowd watching saying that yes, they feel like doctors only want to prescribe drugs with side effects. And I would say you're right. There's a great book by Robert Lustig called Metabolica, and he outlines the beginnings of how medical schools started. And basically, Rockefeller cut a deal with a drug company and started med schools focused on drug therapy because they knew it would be a moneymaker. So we are where we are. But there's a lot of us trying to do better for you out there, I promise. Next. Aging, gut, and inflammation. Sometimes people come into my office and tell me that another doctor told them they were bone on bone and there's no help. You're always going to be in pain and your only hope is a total joint replacement. Okay, so what just happened? Their mindset got completely set in a negative fashion, and it's not true. Again, no x-ray finding has ever been correlated with a symptom. So you can't say that just because you see bone on bone that they're never going to not hurt. And yes, supplementation can help these people because the pain is, again, from inflamed nerve endings and inflammation and oxidative stress. So if you can control the electrical signal from the nerves at the joint to the brain, then you can control the pain without controlling the underlying bone on bone, right? So if you can make the nerves fire less often by giving it omega-3s that are more pro healing and resolving and less inflammatory, by reducing the oxidative stress and inflammation with things like the tart cherry extract and the turmeric, and different phytochemicals like PEA and alpha lipoic acid. So if you could control the damage markers, the biomarkers that way, you'll have less pain. And then if you can improve strength, flexibility, things like that, then any given site of arthritis becomes less relevant over time. And then of course mindset helps. And then controlling levels of glycemic indexes in your blood also helps, because you reduce the advanced glycation end products, which also cause the pain. So things like berberine, which will reduce your glycemic load in the blood and actually acts like metformin, that can help control pain. Things like resveratrol, that's been studied in conjunction with Mobic and by itself, also very good at controlling arthritic pain. So I don't think that people should just give up because one doctor told them they're bone on bone and all you have left is a total knee. Now, some people really believe that, and I would say do all of this anyway, because when you go get that total knee, hopefully you won't fall into that 20% group where you still have pain, chronic pain for the rest of your life. Hopefully you'll fall into that 80% group that does okay, and you may or may not need a revision down the road, but at least you're doing okay. So yeah, I would say even if you've been told that you're bone on bone, maybe go get another opinion. There are ways to treat that pain with diet, sleep, mindset, supplements.